Hello everyone, welcome to Santa Fe College Nursing Labs. Today I'm going to be demonstrating a wet to dry dressing change following the 9 principles of sterile technique. The first thing we need to do is go ahead and check out doctor's orders and for the description of the dressing change. So I'm going to go over here, open my patient's chart, and take a look at the order. Next I'm going to go ahead and gather my supplies. Okay, now that I have all of my supplies, I'm going to go into the patient's room. You want to remember to always bring a couple of extra supplies, extra gloves or gauze dressings. Sometimes you're never sure how many gauze pads you might need to put into the wound, or if you break sterile technique, you might need to change your gloves. So I'm going to enter the room. I'm going to wash my hands or sanitize. And I'm going to introduce myself to the patient, identify the patient, and let them know what we're going to be doing. Hello, Mr. Jones. How are you doing today? I need to go ahead and do your dressing change. Can you please tell me your name and date of birth? And I'm going to go ahead and check the patient's ID band as well. So, Mr. Jones, are you feeling any pain, or do you have a lot of pain when we do dressing changes? So if needed, I am going to go ahead and pre-medicate the patient with some pain medication before we do the dressing change. Okay, so now that I've pre-medicated my patient, if needed, I'm going to go ahead and set up my supplies. You need to make sure you have a trash can or a biohazard can. I'm going to go ahead and raise my table and move it over in my patient. You can also open your table up to give you more space. Okay, so the supplies that you need to do a wet to dry dressing change includes normal saline or sterile water, a pair of sterile gloves. I have 2 here just in case I contaminate the gloves when I'm putting them on or during the procedure. You need a roll of tape, a tape measurer. We also need some Q-tips to help us measure the wound and then also to pack it. We need an ABD pad as well. I have 2 here just in case. This is my sterile bowl that contains my sterile 4x4 dressings. Every institution has a little different setup. Here we have a sterile bowl that has the dressing in, covered by a sterile drape that we will use for our sterile field. So now the first thing we need to do is expose the wound and then remove the old dressing and measure the wound. So this is done using clean technique. So we're going to expose the patient. So I'm just going to move down your sheet and lift up your gown, Mr. Jones. Okay. So I need a clean pair of gloves. When I remove the dressing, I'm going to pull towards the middle of the wound so that I do not pull the wound apart. Okay, so when I lift the dressing up, sometimes the whole dressing, including the packing, will come out. Other times you'll just get the packing in pieces. You always want to remove the dressing where you're removing the top part closest to the head down to the bottom. The bottom part of the dressing, the part that's closest to the feet, is always going to contain the most drainage because of the way the patient is sitting and gravity. Okay, so part of my dressing came out. I can use Q-tips or I can pull with my gloves to get the rest of this dressing out. I want to make sure that I observe the dressing. This dressing hasn't got any drainage on, so I'd want to note whether it was still moist, whether it has sanguinous, serosanguinous, or what looks like pus, exudate. I'd also want to see if it's on all layers of the dressing, whether it's just on the packing or whether it's on the ABD pad as well. After this, I'm going to go ahead and wrap my dressing up. And if it's very saturated with blood, it's going to go into a red biohazard. If it has very little blood on it, it can go into the regular trash can. I'm going to attempt to wrap the gauze dressing inside of my gloves. Okay, and then I'll go ahead and throw this into the trash can. So now that I threw out the old dressing, I'm going to go ahead and wash my hands or hand sanitize. The next thing we're going to do is measure the wound. So I'm going to attach my tape measure to my table to use. We're looking at the centimeter side or millimeter side. Some of the gauze packages or Q-tips will actually have a tape measure on in case you need that as well. Okay. So I'm going to go ahead and put on some clean gloves. I am then going to open my Q-tips and measure my wound. You want to make sure that you keep the end of the Q-tip sterile or as clean as possible. Okay, so with my first Q-tip, I am going to be measuring the length. You try not to touch the wound. So that is about 13.5 centimeters. I'm then going to do the width. And the width is about 2.5 centimeters. Okay. I'm then going to throw this first Q-tip out. So I'm getting my second Q-tip in order to measure depth. So I'm going to go ahead and measure the depth. And that is about 3 centimeters. And I can throw that one out. And I will also dispose of these gloves. Okay. I'm going to write down my measurements on my tape measure here so I do not forget. So now begins the sterile part of this skill. I want to arrange my supplies so that the supplies I'm using first are closest to the patient. I'm going to set up my gloves and put on my gloves on the side of the table here. I want to loosen the cap of my sterile water or saline. When you gather your supplies, you want to make sure that your sterile water or normal saline is not expired. If you are the first person opening this bottle, you also want to date. Usually these bottles, once open, are only good for 24 hours. You would grab your marker and go ahead and date an initial. So I'm going to loosen my cap so that it's easier to open later on. I have my sterile bowl. I'm going to put my supplies over here. And I'm going to open my sterile field. So when opening up my sterile bowl, I'm going to open up the furthest flap first. Then I'm going to open up the 2 side flaps. And then I open the flap closest to me. Okay. Any flap hanging over a table would be considered non-sterile. And remember, the 1-inch border around your sterile field is not considered sterile. Next, I need to go ahead and add my other sterile supplies. So the first supply I'm going to add to my field is my sterile ABD pad. You want to minimize the amount of time that you are over your sterile field. Next, I'm going to put my extra supplies off to the side. And I'm going to go ahead and use the other side of my table to put on my sterile gloves. So I'm going to don my sterile gloves. I'm going to only put one sterile glove on to begin with. Move my trash can. I'm going to place the sterile glove on my non-dominant hand first. I'm going to keep my hand up because this hand is now sterile. I want to go ahead and arrange my supplies on my dressing. I need to pour the water into my bowl. Remember, if water on a sterile field lands onto paper or fabric, it is then considered contaminated, which is why we're pouring into a sterile metal bottle, or you need to pour into a sterile, some other sterile container. So we're going to arrange our supplies. Our ABD pad is used last, so I'm going to put it furthest from the patient. Our Q-tips are used in the middle. We have 4 gauze dressings in the bowl. I need to remove 2. 2 are going to be moist and 2 are going to be dry. I am then going to remove my cap. You want to place the cap facing up. You also want to, when you grab the bottle, you want the label facing your palm so you do not drip water on the label. I want to avoid reaching over my field. Okay. So before putting on my second sterile glove, I'm just going to make sure I have enough water or sterile saline to moisten my gauze, which I do. I'm going to recap my bottle. Seem to have, that's plenty of water. Okay. I am now going to put on my second sterile glove. Okay. Now that I have both of my sterile gloves on, I am going to begin to pack the wound. So you want to grab the first of the 2 dressings and you want to just wring out any excess water into your bowl. I'm then going to open up the gauze pads and what we call fluffing them, which is just increasing the surface area a little bit, making it easier to pack. So you just need to open it up once. And then we're going to go ahead and you can either fold it or you can make like a tube. And then you want to gather your dressing up like an accordion. We need one of the Q-tips to help us pack the wound. You do not want to let any of the gauze touch the patient's skin that is intact, because the moisture over time will cause breakdown of the skin. So we want most of the dressing inside of the wound. You can use the Q-tip or you could use your finger to pack the wound. You want to start from the top to the bottom. And you usually replace, if I pulled 2 gauze dressings out here, you usually know that you need 2 more to replace. So I can discard this first Q-tip. I do not want to turn my back on my sterile field. I'm going to grab the second dressing now, wring out any excess moisture. Again, I'm going to fluff my 4x4. So it's opening once. Opening twice. Okay. Again, you can either fold it or you can create a loop, like a tube. Then I'm going to gather the dressing up like an accordion. I'm going to get my other Q-tip, and then I'm going to pack the rest of my wound. So I finished packing my wound. If there's any excess dressing, you want to put it on top of the other gauze and not on the patient's wound. I'm going to go ahead and throw out the Q-tip without turning my back on the patient's, on the sterile field, and without lowering my hand below my waist. Next, I'm going to get the 2 gauze dressings, dry ones, to put on top. You want to go ahead and open your dressing. You want the crease to be facing up, and you want the double part of the 4x4 gauze at the bottom of the wound. That's where most of the drainage is going to be when the patient is sitting or standing due to gravity. I'm just going to go ahead and drop this onto the wound. Wherever it falls is where it stays. I'm going to grab my second dry piece, and again I'm going to open that up. Make sure my double fold is at the bottom and the edge is facing up, and I'm just going to go ahead and drop that over the wound. The last part of the dressing is the ABD pad. The ABD pad has a blue line. This is the line that faces the sky, which is always a good way to remember, blue for sky. You want to go ahead and open up your ABD pad. Try to avoid touching the part that's going to be against the wound. And I'm just going to go ahead and place this on the patient. So I placed my ABD pad on the patient. For this patient, the wound is in the middle of the abdomen. It's not going to fall. If you are doing a dressing on a foot or the side of the patient, as soon as you let go of this dressing, it's likely to slip off. So in that case, you want to make sure that you maintain your hand on the dressing until it is taped down and secure. Since this dressing is not going to move, I am going to let go and grab my tape. Now that the dressing is on the patient, this concludes the sterile part of the procedure. I have my tape, which I'm going to tab the end off to make it easier. Kind of estimate about how much I want. You want to avoid putting excess tape on your patient. Going to go ahead and secure the middle first. Everyone tapes their wound a little differently. You can do a picture frame, or you can do the 3 pieces of tape across. The main part is the bottom needs to remain closed. I'm going to get my third piece of tape. I'm going to secure the bottom part, and you want the dressing at the bottom to be closed. And then the last piece of tape. Now you either need to label it now, Or once you put your tape on, you can pull a smaller piece of tape and put it onto the dressing, but you do need to label your dressing with your initials, the date that the dressing was changed, and the time. I'm going to go ahead and put the last piece of tape, and you do not want to occlude the top of the dressing. I can now remove my gloves. And discard. Going to cover the patient back up to provide privacy. So that concludes the end of our wet to dry dressing change. When you leave your patient, you want to make sure that the bed is in a low position, they have their call light, and they are left in a comfortable position. Thank you so much for joining us, and I hope to see you next time. Remember, there are other nursing videos from us that you can watch too.